It's no surprise to colleagues in primary care, I'm a practicing primary care doc, that we face a lot of challenges in this time of change right now. But this is also a time of enormous opportunity and hope, and I think we see that with the students and residents going into primary care. They see things changing, they see models changing, they see priorities changing, and that's exciting. Now, a lot of my colleagues, they say, I'm struggling just to keep my head above water, and we know from great studies that if a primary care doc for an average panel were to do everything that is recommended in the guidelines, they would work over 19 hours a day, and that's without seeing patients for any acute visits. So, the question should be, how in the world are we supposed to do all this great new stuff? And my answer to that is we're not going to improve by working harder. We're going to improve by working smarter. And the way to work smarter is to work through teams and to work with our patients. And let me break that down for you. So because we have so much to do, because healthcare is only getting more and more complex, because our knowledge about medicine and the body explodes at a pace that outpaces our ability to keep up with it, we have no other choice but to work in teams. But beyond that lack of choice actually comes a very affirmative choice, which is that teams are fun. When I started working in the team 3-4 years ago, I noticed my joy of practice increase. I noticed the quality of my interactions with my colleagues increase. I noticed my ability to provide the services to the patients that we treat increased. And that's deeply satisfying and deeply meaningful on a sustainability and a burnout reduction type of paradigm. We need to increase the joy of our work to increase the quality of our work. And so working in teams, and yes, partnering with our patients meaningfully, not just taking their comment cards, not just seeing what the surveys say, but bringing them into our journey of transformation, helping us to understand where we should go because they're our end users. That's deeply satisfying as well. They have great suggestions. They can help us from going astray down rabbit holes of well-intentioned morass that we could otherwise avoid. And they're deeply grateful for being in partnership for us. I think this is a new paradigm. And yes, it does require us to be a little bit stepping down from our paradigm as all-knowing doctors in white coats. But what's wrong with that? That era is over. And the era of being partners with our patients, being guides, being advisors, trusted advisors with evidence, with relationships, and with the ability to coordinate through fragmented systems. What else could we be doing that's better than that? And by working in teams and by working with patients in our teams to improve our practice, we can get to a better place.